My name's Chris Gester, and I'm the President and CEO at Akron Children's Hospital. Our mission at the hospital is to improve child health through excellence in education, patient care, teaching, research, advocacy, and community partnerships. The vision is to be the most trusted, inclusive, and accessible pediatric health system in the communities we serve. So we have a very interesting history. We're 135 years old, turned 135 in October. We were founded as a daycare for factory workers' kids by 75 talented, dedicated women. That was the Women's Board, the Akron Children's Women's Board. And that Women's Board is still very active in our hospital today. They serve on our board of directors. They run our gift shop, which is top-notch. They volunteer in other areas. And they've really helped us raise millions of dollars over the years. It's probably easier for me to tell you which specialty care we don't offer. We don't do solid organ transplant for kids. We'll take care of them pre-transplant and post-transplant. We typically partner with Children's Hospital Cincinnati for some of our transplant patients who need to go out of town, but as soon as they're ready to come back, they send them back here so we can provide care close to their home. We are in the process of getting our 5th magnet designation, and really only about 2% of the hospitals in the country have achieved 5 magnet designations, and it's given by a nursing professional organization, but it's really recognition from the entire hospital. And our nurses, we probably train 950 nursing students every year here. We have a wonderful residency program. We've got a rich history of national accomplishments and awards from a nursing perspective. One of our nurses won Magnet Nurse of the Year this year. And if you look in our hospital, there's many nurses who have built outstanding careers here. In fact, there's 3 nurses who report directly to me who serve in executive roles here at the hospital. So I think it's a great place for nurses to work, to learn, to develop a career. And obviously, if you have talented, dedicated, smart nurses, you have a great hospital. I think our staff are very special. They're very cohesive. You know, they don't let each other fail. They support each other. They collaborate. They're very talented. They're dedicated. They're hardworking. And they come from a lot of different backgrounds and experiences. Many of our physicians trained at other hospitals, and they come here and bring those ideas here to Akron. So I really think it's a team effort here, and everybody's very focused on improving our service every single day. We train a lot of physicians here at Akron Children's, and one of the things we're very proud of is every year we have about 26 pediatric residents. So they come out of medical school and they want to be a pediatrician. They spend 3 years with us, and then when they're done, they have to take their boards. In this most recent year, we had 100% of our graduates pass the boards, and the national average is 80%. So we like to brag a little bit about that. So I think one of the strengths of the hospital is our ability to partner. We partner with adult hospitals. In many cases, we work with hospitals that deliver a lot of babies, and we run their neonatal intensive care unit right in that hospital. But we also partner with schools. We have contracts with 43 different schools throughout Eastern Ohio. I think we're in 200 different buildings providing health care to kids. We partner with the YMCA. Recently, as an example, we ran a camp at one of their summer camps for kids with behavioral health challenges and so forth. We adopted Akron Public Schools, the North High School, and we have a career academy for those kids. They spend the summer with us, work throughout the year, where we're trying to build interest in healthcare careers with those students. There's just many, many, many different partnerships that we have. It's sort of built in our DNA, and we're appreciative of all the support we get from the community. So one of the things we've been working on, it's sort of more of the same coming, and that is we've been trying to be very, very accessible to our patients and families. And we know that many patients don't like to call for appointments, so we've been moving things to online scheduling and scheduling without a phone call. We're right now at a little over 50% of our appointments, and we have many, many, many appointments, probably over 1 million visits a year with all our different doctors, and over 50% of those are scheduled without making a phone call. And our goal is to get to 75%. So that's definitely something you'll continue to see more of. We're going to continue to grow in underserved communities. So where we see unmet needs, regardless of whether it's rural, urban, underserved, we're going to go in and try to figure out a way to meet those healthcare needs for kids. If you're looking for more information or want to schedule an appointment with one of our providers or physicians, you can go to www.akronchildrens.org. Thanks for watching. Please know that we take our responsibility of taking care of your kids and your family very, very seriously.